Another option that we use sometimes, especially for peripheral procedures like hand surgery, for example, would be a regional anesthetic. So instead of putting the entire patient to sleep under general anesthesia, we would use a local anesthetic and just numb up a certain part of the body, for example, an arm or a leg. That has been reported in both children and adults and has some advantages, but the risk is some infection because the skin integrity is not normal and colonized with bacteria. So that's a little overview of what I think about as an anesthesiologist, and I hope has been helpful to you to get a little insight into what we're doing while you're asleep or your child is asleep under anesthesia. What I want to do for the last couple of minutes is just to give you some tips as a parent or a patient for what you can do to help your anesthesia care providers really give you a safe, effective anesthetic. I always encourage parents to bring their supplies. And generally, I don't need to say anything because you guys travel with it. But I think that's helpful, especially if you come to a new institution because they may not have exactly what you're accustomed to using. I would encourage you to bring your latest medical information, any lab results, echocardiograms, medication lists. That's very helpful to us to get a full picture of your child's health status. Don't be afraid to let us know what works or what doesn't work. You've been with your child for many years. As an anesthesiologist, I come in, I have a brief time with you, and I try very hard to get a full picture. But if you can give me information like, hey, last time this really didn't work well, can we try something different today? That is so helpful to me. Don't be afraid to advocate for your child. And one source of information that you might find helpful is the Deborah website. There's a section there called Anesthesia Guidelines that I wrote a few years ago, and that might be helpful to you. What questions should you consider asking your anesthesiologist, especially if you're showing up somewhere and you have no experience, you have no history with them? And you might be a little worried because you know that EB is not a common disease, and it's a little bit tricky sometimes for anesthesia. I would ask about that person's experience with epidermolysis bullosa. It's nice to have experience on your side. One thing you might consider asking for is anesthesia consultation ahead of time. When patients with epidermolysis bullosa come to Cincinnati and they're new to us, we always do an anesthesia consultation where we'll spend at least an hour with the patient getting a complete review of your health history, a careful physical exam, and time for us to come up with a good plan and for you to be at leisure to ask questions about your child's anesthetic. Ask about the plans, alternate plans, and I think it's good to know, to ask, what kind of difficulties do you think we're going to anticipate today? All right, so what to do in an emergency? I know many of you may come to an EB center, but you may find yourself needing an emergency operation somewhere in a place that doesn't do a lot of EB. Here are a few thoughts that I have that hopefully will help in that situation. Be sure the anesthesiologist is prepared and informed. Honestly, when I started taking care of EB patients, I said, wow, this could be really tough. If you take someone who's not a pediatric anesthesiologist or someone who only takes care of EB patients occasionally, it can really be very, very stressful for them. So keep that in mind. You might say to them, hey, there's a really nice resource on the internet, the Deborah website, and I've written that specifically for anesthesiologists in a very practical step-by-step fashion. So that might help them. The other thing that you might do is say, hey, I usually go to Cincinnati, Denver, wherever you go, a place that's an EB center. And you might say, could you please call the anesthesiologist there, and maybe they can kind of give you some ideas for how to provide effective anesthesia for my child. The last thing I want to talk about is evaluating the quality of care. As a parent, you always want the best for your child. How do you figure out what's best in terms of anesthesia care? I think anesthesia is very experience-driven for rare diseases like this. You should look for competence, for kind of an organized system, for protocols, a real sense of caring there, and keep in mind that it really takes a team of people to provide effective perioperative care for EB patients? Do I feel listened to, and is there clear and open communication? So, with careful preoperative evaluation, a high level of skill, and good judgment, anesthesia can be given very safely to patients who are undergoing surgical and diagnostic procedures which will improve their quality of life. My friends, Tim and Melissa, are living proof of that. They've had multiple anesthetics. They've done very well, and it has really been a pleasure to speak with you. If there's time, I'm open for some questions. I think we have a few minutes if there's some questions.
Yeah, I was just curious about the EB simplex. And are there different versions of that, or are there different, I noticed you had the dystrophic was the worst, but on the simplex, how do you gauge that?
All the major types of epidermolysis bullosa, the EB simplex, junctional EB, as well as dystrophic EB, have different variants and subtypes. The issue for anesthesia and epidermolysis bullosa simplex is primarily being gentle with the skin. Fortunately, those patients do not usually have a lot of other organ systems that are not working well.
All right, thank you.
Absolutely. Other questions?
I was just curious if there's any danger in terms of applying like a lidocaine cream on a regular basis for EB patients to control pain.
I think you have to use that carefully, because if you have a denuded area of skin, as many of these patients do, the systemic absorption, in other words, how much of that lidocaine gets absorbed, will be higher than if you apply it to intact skin. And if that's being done on a routine basis, I would encourage you to do that in consultation with your dermatologist. Any other questions? Well, I'll be around for a little bit this afternoon. If I can be of help to you or service to your child in any way, go to the Cincinnati Children's Hospital website. I've spoken with anesthesiologists across the country in both elective and emergent kind of situations, and I would be happy to help you however I can. Thank you so much.